Tinatawag nilang new normal ang mga aksyong nakasentro sa pagpapahalaga sa kalusugan. Ginagawa natin ang new normal behaviors na ito ngayon upang makaiwas sa COVID-19. Pero kung tutuusin, marami sa mga hakbang na ito ay mga kaugalian na ating natutunan at dapat ginagawa noon pa man. Makakatulong ang mga ito sa pag-iwas sa anumang sakit. Tulad ng paglilinis ng kamay, tinuro sa atin simula pagkabata na maghugas pagdating sa bahay, bago kumain at pagkagamit ng palikuran. Sa panahon ngayon, dapat mas madalas na ang paglilinis ng kamay. Bukod sa paggamit ng tubig at sabon, maaaring gumamit ng alcohol-based hand rub o sanitizer kahit nasan ka man. Kapag naglilinis ng bahay, kailangang mas dalasan ang pag-disinfect ng mga bagay na palaging hinahawakan. Makakagawa ng pang-disinfect gamit ang ordinaryong bleach na panglaba. Maghanda ng isang parte ng bleach at ihalo ito sa 9 na parte ng malinis na tubig. Kung hindi naman emergency, hindi na kailangan pumunta pa sa doktor dahil sa telemedicine. Kapag nahihirapan sa paghinga at iba pang malalang sintomas ng sakit, agad na kumonsulta sa doktor. Maaari ring tumawag sa Barangay Health Response Team o BHERT. Huwag kalimutan ang mga natutunan dahil ito ang ating sandata para maging handa sa new normal.
Good morning po, magandang umaga sa lahat. Good morning to all our viewers. Welcome to the third and last day of the Healthy Seniors webinars, a series by the Department of Health and WHO Philippines, together with the Philippine College of Geriatric Medicine and the UP National Institutes of Health Institute of Aging. My name is Dr. Albert Domingo from the WHO Philippines office, and it is my honor to be your moderator for this webinar series. We opened the series with a lively discussion on how to stay safe at home, giving particular attention to the promotion of the health of older people, including fitness tips for our lolos and lolas. The other day rather, on day 2, we talked about what senior citizens can do should they fall ill during this time of COVID-19, and also how to go about accessing healthcare services. Today's session will be about caring for senior mental health. Yan. Kahapon po, there were a lot of questions about senior mental health, particularly dementia, Alzheimer's. Yan. Yung bang the term that we use in the local language, ulyanin. Totoo ba yun? Is it normal? Talagang makakalimutin ba? Do seniors easily forget things? Or is there something that is going on? We'll find out. Doctors Jasmine Vergara and Michelle Anlacan will discuss the mental health concerns of older people, including dementia and Alzheimer's disease, plus the advocacy and actions of an organization working in this field. Dr. Martin Van den Dyck from the WHO Regional Office for the Western Pacific will be joining us in today's panel alongside Ms. Carla Cuadro, a speech pathologist. Yan, baka may mga tanong rin kayo mga kaibigan, ano po ba yung speech pathologist? Yan, we will hear from Ms. Carla later. Our format is the same. We will hear from our two speakers and then we will have an open forum. To ask a question, we highly encourage those in the Zoom room. There are 345 already and the number is going up. To please use the Q&A button in your app. Meron po tayo sa baba, Q&A button. Para po sa ating mga lolo and lola na hindi pa masyadong familiar pero sure ako mga techie na rin po kayo. Para if you want to if you need help rather, ask your companions, ask your caregivers, your apos, to click on the Q&A button so you can type the question there. For those joining us from YouTube, please type your questions into the live chat box. Yes, we are live on YouTube. I will be posting the link later in the chat box so you can share forward on Viber, on Telegram, on WhatsApp, on your messaging applications. So we are all set. I will now turn over to our first speaker, Dr. Jasmine Garcia Vergara, to give us a discussion on caring for senior mental health, including dementia and Alzheimer's in the time of COVID-19. Over to you, Dr. Jas.
Thank you, Dr. Albert, and good morning to everyone, especially to our senior members of family, friends, community. Let me just share my slide. All right. So I'll be talking about caring for senior mental health, including dementia and Alzheimer's disease in the time of COVID-19. My discussion today will focus on why focus on older adults. For the past couple of days, we have already highlighted the reason why we are focusing this intervention for the older adults, the common mental health and psychosocial stressors experienced by older adults, people with dementia and other conditions, the mental health and psychosocial considerations for older adults, considerations for family members, caregivers of older adults, and caregivers of people with dementia, and considerations also and a focus on equity and human rights. So before we proceed with all of those elements, I'd like to further highlight and discuss the definition of mental health. For everyone's knowledge, this is the WHO's definition of mental health. It is a state of well-being in which an individual, we are able to realize your own potential or abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. So ito importante itong definition na to because it's not just the absence of the mental disorders, it's beyond that. But when we talk about mental health, it has large intrinsic value, and as it relates to the core of what makes us human. As a human being, ito yung kapasidad natin, ang mental health kapasidad natin, the way we interact with other people, the way we learn, the communicate, experience happiness, or even sadness or sufferings. When we talk about also good mental health, it also supports the capability ng lahat, especially for the seniors sa ngayon, is for them to display healthy behavior that will actually keep themselves protected and healthy in this COVID-19 pandemic. Those are the important factors. Why are we considering mental health? The way we also take care of our mental health should be the same as how we take care of our physical health. So as mentioned, for the past couple of days, we focus on older adults because the older population is incredibly diverse. Older adults are at higher risk of developing more severe symptoms of COVID-19 and of dying as a result. Older adults also may have limited access to accurate information because of the disruption of information services and also other means. They are more likely to fall victim to misinformation about the COVID-19 pandemic. Ito yung mga tinatawag nating fake news or false or misinformations. The stress and social isolation associated to the measures put in place to contain the COVID-19 may exacerbate underlying mental health or neurological conditions. Dr. Mission Lacan will also expand on that, some available how to take care of that. Some older adults, including those with disabilities of cognitive decline or what we call or dementia, may not be able to access this kind of support during the lockdown. They also are in need of required, continuous care and support from the different intervention services as well. And due to their risk, their health risk profile, the older adults may be in the one of the last population groups for whom lockdown measures are lifted. I think lately we have seen how the lockdown measures or the community quarantine has been expanded, but sila yung huli na lift ang measures. I'll just touch briefly on what is dementia. Although dementia is a syndrome in which there's deterioration or the ability to perform our daily activities, difficulty with everyday tasks, may have some confusion in familiar environments, difficulty with words and numbers, some memory loss, and changes in mood and behavior. Although I'd like to stress here that although dementia mainly affects the older population, it is not a normal part of aging. We can age and grow old without having to have dementia, and we can tackle later some activities or ways that you can decrease the risk of developing dementia. So to proceed, what would be the common mental health and psychosocial stressors experienced by older adults? The older adults population, especially in isolation, are those and those with cognitive decline, and as mentioned with dementia, may become more anxious, more angry, stressed, agitated, and withdrawn during this certain situation, or in quarantine, or while we are in quarantine, because of the previous conditions na nila or other medical conditions or factors that are contributing already before the COVID-19 came, and now that the COVID-19 is here. So these are some of the common mental health and psychosocial stresses. Also, some older adults may react more strongly to stressful events and take more time to recover from stress, which can affect both mental and physical health. As mentioned, meron na nga silang underlying conditions with all the other measures in place to protect them from having contracted the infection. It is important that older adults remain physically active and socially connected or socially involved with others, and so that they can feel productive. And that's how we take care of their mental health, as we have defined earlier. Physical activity and exercise can also improve cognition and reduce dementia risk. So you target, all of those elements as well. So there are ways that we can have, the other day, our guest speaker talk about some stretching activities, physical activities that can improve the cognition or the mental health and well-being of our older adults. Stress related to COVID-19 may also exacerbate, as mentioned, pre-existing fears and anxieties related to dying or dying alone. So when we would want to address this, and we would want to facilitate appropriate cultural, spiritual, religious practices and rituals that can ease the distress and enable mourning and grief at the population level. Ito yung mga elements that we need to have, not just beyond the health sector, the other sectors that can contribute to support appropriate cultural, we have seen or experienced our older population gathering in a Zoom video prayer or a mass, and hearing an online mass either via our social media platform or TV or the radio. So there are ways to practice these rituals, but kept at a safe, distance for everyone, especially for our older adults. So some of the mental health and psychosocial considerations for older adults, especially the ones who are watching today. So we would want to highlight that for you to have regular routines and schedules as much as possible. You sleep at a certain time of the night and you wake up, at a regular time of the day to have your regular routines, or help create new ones in this new environment that we're not able to go out as much. We cannot go out to our usual, restaurants or gatherings. We can include exercise as mentioned, the benefits of it, cleaning, daily chores, singing. You can have some painting or other activities that you find meaningful or you actually enjoy. Make sure that you have at least 2 weeks of supply of all regular medicines that you may require. It's important to have para tayong 10 steps ahead. We are able to plan in advance and anticipate para hindi tayo, it will not add up to additional stress na, oy, ubos na pala yung medication, paano kung walang kukuha ng gamot or yung reseta, or paano bibili ng medication sa pharmacy. You can also have a plan or write down a plan or be prepared and know in advance where and how to get practical help. May it be calling a taxi. Paano ba mag-put up ng app so I could get, a taxi app or a Grab or what? How to have your food delivered without accessing, without, adding risk to you and in a safe measure, with safe measure rather. So ano yung mga available? Ano ba ang available sa community natin na pwede tayong mabigyan ng delivery for fresh foods and fruits and vegetables, some meat and products that we actually that are actually healthy, or mga pagkain na luto na. Pwede din tayo mag-prepare paano tayo mag-access ng medical care. Kunyari, it's time for our appointment. How do we do that? How do we contact our doctors? How do we get our prescription and so forth? It is also very, very important to ask family members, friends, or neighbors for support if needed. Important tayo na magbumula rin sa atin na kailangan natin ng help because we are limited in this, sa homes that we are not able to go out. As mentioned here, having to have some social connectedness, having to maintain that social connection despite the current situation. We have to have some regular contact with our loved ones, especially kung nakasanayan natin before na Sunday gatherings, lunch, or weekend gatherings with family, pwede itong mangyari through contact ng mobile phones or other means of mobile apps or applications or connection. Pwede naman tayo mag-email, mag-write ng letters, or tumawag using the phone. Siguro we can ask the seniors present in our webinar, ano ba yung means na na-reach kayo, or ano yung pinaka most common platform na nakakipag-ugnayan kayo sa mga loved ones, sa mga kaibigan, at sa mga kapitbahay. Kasi nga mahirap sa sitwasyon na to at hindi natin to sanay before. I'd just like to go through with you. This is a guideline of how to maintain psychological well-being. It's from the WHO Western Pacific Regional Guidance on the COVID-19. This was lifted, and I believe this was already sent over for the participants, but we will send it again, available online. But I'll let you go through this first. First is try to reduce how much you watch, read, or listen to the news. Because kung marami tayong palaging napapanood, napapakinggan ng left and right, hindi natin alam kung tama ba yung information ninyon, or or sinasabi lang fake news or misinformation, it will add up to our stress. So important na bawasan natin yon. Lalo na kung nakaka-feel iyon ng mga upset sa atin, or it makes you feel more anxious or distressed. So importante na we seek only information at specific times of the day. It can be once or twice daily. Maybe siguro pag sa morning nyo, para kung makapag-ready kayo anong mga balita sa araw na to, o kaya isa sa hapon. Hindi yung palagi. Follow trusted news channels such as local national TV, radio, and keep up to date with the latest news, especially from the Department of Health, also from WHO, on the verified social media account. There's also recently that we have released some advice. Kung naka-receive kayo ng information at hindi kayo masyadong convinced, huwag nyo na ipasa sa iba. Kasi kung kayo mismo hindi convinced, huwag nyo na ipasa kasi it might add more stress to the person you are actually sending it to. Second is be aware of your negative or unhealthy thoughts. Now, back in fairy tales and stuff like that, Peter Pan, what are your happy thoughts? Try thinking of 3 happy thoughts every day. how these happy thoughts makes us feel, alive, bright and happy. Try repeating these words such as relax and calm, and it can help you while you're taking your breathing exercises. It helps you lower down your heart rate. It also lower down and help you feel calm and connected to the environment that you have. Second, as mentioned, stay socially connected, can be video calls, messaging, and writing letters. Number 4 is engage in hobbies and activities, right? As mentioned, yung mga pwede rin, bukod sa physical activities or exercises, you can have also some cognitive exercises. How yung mga tinatawag natin, how to exercise our brains, no? Such as reading a book or doing a crossword puzzle. Sudoku, kung ito ay something na you enjoy also, or a board game, enjoy a board game, or a chess with your family members, your mind active and distract you from worrying. So these are just practical tips that can help you, divert your attention to more productive and enjoyable ones. You can also use this time at home to keep a well-being diary. So mga writers, I know some people, older people would like to write their own thoughts and feelings. Please do so. So number 5 is also get moving. So there are different ways. May yoga, may Zumba. My mom, my aunt actually are beyond 65 years old, but they're still active on Zoom and they're actually listening here. So you can find some other online channels or videos that can actually help you practice some, Tai Chi or other means of walking or physical exercises. You can do at pacing lang. Doesn't have to be some strenuous exercises, lalo na sa ating edad. Number 6 is, if you're feeling down, try to help someone else. Ito yung tatawag natin a sense of altruism. When we help another person or another population, another group, it gives us a sense of accomplishment, a sense of worth, and it makes us feel good and happy. So if this is something that can help you, please write letters to the frontliners, write some encouraging words. The older population is full of wisdom. We would encourage you to share that to the younger generation, to everyone that will benefit from your wisdom. Number 7, this is important because we don't want to add more complications or disease condition to already what we have. So avoid using alcohol and drugs as a way of dealing with fear, anxiety, or boredom, and or social isolation. Because drinking alcohol not only disturbs your sleep, but may also increase your risk of falls, Pag natumba tayo, additional accidents can happen, weaken your immune system, and interact with any prescription medicines that you are most likely taking. Limit the amount of alcohol if you do or do not drink at all. So better safe, than experience this additional consequences. Number 8 is seek psychological support. It doesn't have to be a professional, but you can find support in your family, community, your friends. If stress lang or worry or sadness gets in, more consistent and already affect your daily activities, your sleep, your appetite, these are also warning signs that we need to seek professional help. The National Center for Mental Health is available. They have a hotline, local landlines 1553, and they can provide additional references for available services on mental health and psychosocial support. Also, you can also get in touch with your own primary physician, maybe your cardiologist or your pulmonologist or the doctor that you are actually seeing for your medical condition. So they can actually provide some additional support and referral to appropriate services if need be. So these are going to the family members and caretakers of older adults. These are some considerations and some key messages that we want to impart. Provide and share simple facts about what is going on and how to reduce the risk of infection. If you would want to share with them the updates of the COVID-19, ano na ba ang sitwasyon, provide them and use words that older people with or without cognitive impairment can understand. We also have to be conscious about that because there are ways that we can use, let's say, photos or diagrams for them to understand certain information that you wish to share. Instructions need to be communicated in a clear, concise, respectful, and patient way. Mga Pilipino naman ay malaki ang respeto sa mga nakakatandang miyembro ng ating pamilya, and hindi to kumbaga iba sa atin. So mas dagdagan pa natin ang respeto at pasyensya pag tayo nakikipag-ugnayan sa mga people in the older population. Repeat the information whenever necessary. Kung kailangan natin ulitin para mas maintindihan, ulitin natin yon. It may also be helpful for information to be displayed in writing or pictures. May mga available poster style like the Bayanihan or the DOH posters. If you have access to those and you can print them, please print. Print the hand washing steps. You can have them also printed in their comfort rooms or the hand washing areas para mas ma-remind tayo palagi nila. Engage the family or support networks para mas makatulong sa pagpapag-share ng information na to. Provide older people with simple physical exercises, as mentioned, and to reduce the boredom. And as family members, caregivers, or people who support the older adults, provide practical support or emotional support, like such as grocery, food delivery, calling for a taxi, or getting medical care. Sa ating mga responsibilidad naman yon. Importante rin sa pamilya and caregivers of older adults that to look into situation that the lockdown and self-isolation mean that family members or caregivers of older population may not be able to physically visit them. Yung mga malalayong lugar, at saka alam natin bakit tayo mag-maintain ng physical distancing measures. Where possible, family members and grandchildren can visit older adults at a distance. Layo lang tayo, as much as possible, kung andun tayo mag-visit, mag-maintain tayo ng physical distancing. No? The COVID-19 pandemic may also cause additional stress to family members and or caregivers. It is part due to the discontinuation of home care and other caregiver support services that were previously available. It is normal to feel this kind of stress. Hindi to kumbaga kakulangan or kahinaan ng loob nyo. Being under stress is part of the situation that we are having, but you also need to take care of yourselves the way that the older population are also taking care of themselves. WHO has some tools also just to highlight this iSupport online training for carers of people with dementia. Actually, anyone who would be interested would want to check this online. It has 5 interactive modules. The dementia carers can learn what's dementia, how to be a carer, how to look after themselves, how to provide everyday care, and how to manage behavior changes. It also came with iSupport Lite. It has some focus, caring for yourself, some strategies that can help you through this COVID-19 pandemic. I believe there are some also physicians or non-specialized physicians or non-specialist clinicians present in this webinar. So we'd like to take advantage that to share that the WHO also has the WHO image gap, dementia module, and other tools that are evidence-based guidelines for diagnosis, treatment, and management of dementia in non-specialized settings. It's called image gap intervention guide 2.0. It also comes in the app via the iOS and Android or Google Play. There's also the dementia toolkit for community healthcare workers and other elements that we're supporting the Department of Health for more or less more cohesive approach to support people with dementia. Now, also would like to highlight in this presentation and discussion that in equity, when we talk about equity and human rights, the COVID-19 related ageism rather, may exacerbate pre-existing age, gender, ethnic or disability-based prejudice and discrimination. Nakita natin yon, even yung mga healthcare workers natin being discriminated. But we need to take the measures taken in the context of the COVID-19 should respond to the diversity representative of older age. This can be in the forms of avoid labeling older adults as uniformly frail and vulnerable because they are not. No, we have seen a lot of older adults making the most of their lives productive and providing meaningful contribution to the society. We foster a positive attitude towards older adults, promote activities between people of different generations. Diyan natin makikita yung mga support coming from the younger, the child, adolescent, working adults to interact with the older population and make visible the resilience and recovery and positive contributions of older adults. With that, I close my presentation, and this is the reference that we've shared, and we will be sharing this to the participants at the end of the lecture. Thank you. Over to you, Albert.
Thank you so much, Dr. Jasmine. Yan po, no? So, ang daming mga nabanggit na mga links at mga references ni Dr. Jasmine. Wag po kayong mag-alala. Tulad po ng ating sinasabi lagi, lahat po yan makikita nyo sa ating chat box. You can see the references that Jasmine has just shared in her talk in the chat box. All of the links are there, also on the YouTube channel. And do not worry, for those who are asking, Doc, pahingi ng kopya ng slides. Yan po yung mga favorite questions. Doc, nasan na po yung slides? Doc, nasan na po yung video? Darating po yan lahat. It's all in a folder. We will show it again later. Don't worry. But focus for now on what we are discussing. Sayang po yung oras kasi tayo po ay live. Huwag kayong mag-alala sa slides. Susunod po yan. Alright. So having mentioned that, thank you Dr. Jazz. No, yung recap ko lang, no, parang importante talaga yung may regular na routine tsaka schedule ang ating mga senior citizen. And siguro, bago tayo lumipat kay Dr. Michelle Anlacan, so I am now allowing the chat. Yes, bukas na po yung chat sa Zoom. Kasi may tinanong si Dr. Jazz. Dr. Jazz, ano yung tinanong mo kanina? Parang, how are the senior citizens? Can you ask the question again and they can reply in the chat, Doc Jazz?
Baka naman the senior citizens or the senior older population in this webinar can share with us, ano ba yung mga platforms or mga ways to actually, yung mga favorite apps or favorite ways to connect with them. Maybe, is it Facebook, Viber, radio? Important yun.
Yeah. So the question of Dr. Jazz, how are you coping para po sa ating mga seniors and pati yung mga nag-aalaga ng seniors, paano natin napopromote yung interaction? Ngayong sinasabi, meron na nga po nagtanong sa Q&A, someone already asked, and we encourage everyone to please ask in the Q&A section. Bakit ba DOH and WHO and the government IATF are all saying stay at home, avoid interaction, and yet here we are, Dr. Jazz is advising interaction. Can you clarify, Doc Jazz, how do you reconcile that?
Yes. As human beings, as also na-mention natin, itong sinasabi natin isolation or itong physical distancing measures are put in place because we want to reduce the risk of the older population getting the COVID-19, but it should not stop us from being socially connected.
Ayun.
So there are ways.
Kaya pala
Yes.
Dr. Jess, hindi siya tinatawag na social distancing. Kung mapapansin niyo mga kaibigan, if you notice, WHO and DOH always try to use the term physical distancing because you can be physically distant but still socially close to each other. And I'm seeing in the chat box, for example, sabi po ni Alicia de Guzman, they use Zoom, Viber, FB Messenger, sabi ni Ana Demisión, my mom and titas are using FB Messenger. Yan. So, lahat yung mga, yan, sabi ni Evangeline Galan, I connect with family members through landlines. Wow. And those abroad by using Messenger and FaceTime. So if you notice, ayan na-realize po ng ating mga watchers, nag-i-interact pala talaga sila Doc Albert at Doc Justin sa ating chat box. Yes, we are live. Hindi po kami recording. So you can put your suggestions there. But when we go, so for now, magpo-pause muna tayo sa discussion. Thank you, Doc Jazz. When we start discussing again for the next speaker, I will temporarily shut off the chat para po hindi na distract yung next speaker natin. And then the open forum, we will open again. All right? So at this point, I would now like to call on our second speaker. The time is 11:35. Marami pa tayong oras. So we have Dr. Michelle Anlacan, who is a neurologist rather, who will discuss with us, of course, seniors and mental health, but particularly highlighting ano ba ang mga advocacies, meron bang organization, hint, meron bang organization dyan na tumutulong sa ating mga kababayan na may mga senior mental health issues, yung mga nabanggit na ni Dr. Jazz, dementia, Alzheimer's, and a bit more information on that. So with that, I will pass over to Dr. Michelle Anlacan. Good morning, Dr. Michelle.
Good morning at magandang umaga po sa ating mga tagapakinig. Let me share my slides. I will focus more on dementia, managing dementia during this pandemic. So are my slides clear? I can proceed.
Yes, ma'am.
So ito pong dementia care during the pandemic. We were actually forewarned by our friends from China. Of course, we have colleagues there. In the first 2 months of the year, they were already telling us their experiences. They were sharing with us that as early as January, they already stopped nursing home visits and group activities were actually prohibited. And they were warning us to be careful because patients with dementia who get COVID get a lot of delirium. And during this time of lockdown, everyone, including the caregiver, are very prone to anxiety and burnout. So there is a need for a lot of self-help guidance that can be delivered on different platforms. As you can see, our senior citizens reacted well initially. Like in the first 2 weeks, they were actually very happy to see the family members all at home and they were all eating together and it was also happy and nice. But after several weeks, and the weeks dragged into months, so indeed they really started complaining, from the ECQ to the MECQ to the GCQ. And senior citizens, not just senior citizens, but persons with dementia are a special population because you know that they are forgetful, they are dependent on other people for their needs, for their daily needs. So it's very difficult for them to go out of the house for their own protection. And so a lot of families just stop at saying you can't go out or the police will get you if you go out, much to the chagrin of these elderly people. They don't want that, obviously, because the approach is wrong. What we need was to have explained to them what the situation is. And if they forget, because you know how repetitive they are and how their short-term memory is actually very bad, we just have to keep on repeating it. We have to put posters if necessary. But yes, they have complained a lot. Why are they vulnerable? Because they have difficulty wearing masks and PPEs. They really are not comfortable with it. And no matter how many times we say not to touch your eyes, nose, and mouth, they forget it and just do so again and again. They forget how to hand wash and they forget how many times they have washed their hands. They forget how to do social distancing. So suffice it to say that these persons with dementia are really vulnerable to COVID. But again, as Dr. Jasmine said, you shouldn't say it straight to their face. We keep it to ourselves. We try to protect them because we know they are vulnerable, but we don't say it to their face because there are still a lot of things that they can do. And take note that those persons with dementia who develop COVID may have different manifestations compared to other people. No? It can just be a form of confusion, apathy, anorexia, or drowsiness, apart from the usual fever and pneumonia that we know to be the COVID manifestations. So we are actually heading a nationwide study on this, and we can try to find out in 3 months when we wrap up the study. We will tell you if the special population of senior citizens and those persons with dementia actually present differently than other people. And how have the people with us, like the healthcare workers dealing with dementia, how have we stepped up? Well, we have in leaps and bounds. No? We did telemedicine and we became very, very flexible on different platforms. As you were sharing earlier, we learned what our patients actually are familiar with. So, in by my experience, it's mostly Viber, Messenger, Zoom, pwede. They just need a little training, a little practice, and I have trained my secretaries to do that. But using telemedicine, we are able to do extensive pre-consultation questionnaires. We are able to get a very good history and the timelines, number of their comorbidities, what their medications are, their latest laboratories and neuroimaging, and we can do all the scales that are necessary. So, among the illnesses in neurology, it seems that telemedicine is apt for it seems that dementia is apt for telemedicine. So we used to say that these are the standard pharmacological treatments for dementia. It depends on what dementia you have and what stage you are in. No? Of course, you need a physician to administer these medications. But if you do not have access to these physicians, then that is a problem. No? So you can access the general practitioner, or you can also try to handle them non-pharmacologically at home, meaning just with proper care, good environment, and you may able to manage them until you are able to access better health care. The reason being that as the dementia unfolds, they are prone to a lot of neuropsychiatric symptoms, no? And this is not exclusive to Alzheimer's disease. All dementias have this. So as they go through the stages of mild, moderate, and severe disease, they can have apathy. No? They can just sit there all day watching TV, but not really comprehending or not reacting, or they won't answer your questions. They will just say yes, no, or that's it. They can be very depressed or clingy and anxious when family members leave. They can have aggression, especially if they have a lot of unmet needs. They have difficulty sleeping because, well, they lack physical activity and they really have nothing to do at home during the lockdown. They can become very irritable, especially when, yeah, they have a lot of unmet needs. Their appetite shifts. They have a tendency to prefer foods that are actually bawal, not sweets or high calorie stuff. And then they can have delusions, disinhibitions, and even hallucinations, which are very, very distressing for family members also. And as a general guide, so this is what we advocate, the DICE approach. Whenever you are encountering behavioral symptoms associated with dementia, you try to describe the event. What is the event? When did it happen? Where did it happen? Who do you think triggered it? Try to investigate the circumstances, make a list of the medication, try to check for drug interaction, look for undiagnosed illness and poor sleeping habits. Sabi nga ni Dr. Jazz, no? You try to sleep and wake up at the same time every day. This is a challenge for senior citizens, more so persons with dementia. It's really, really challenging, and it will really test your patience. And then you have to create and develop a plan to tackle the issue, and you have to evaluate and assess that plan if it's still working. So the most common example of a behavioral problem is difficulty sleeping that can cause a lot of agitation and a lot of stress within the family. So you try to investigate the circumstances. Is the environment conducive to good sleep? Is the time like very early? Do they sleep at 7? Of course, if they sleep at 7, they will wake up very, very early. So that's not good. Try to check for stimulants, or did the patient have a lot of naps during the day, so much so that the body is so well rested it can no longer sleep at night. And then check the medication list for stimulants or sedatives also, and drug interactions. Try to check for pain. And also, there are a lot of people with sleep apnea, no? Yung humihilik, tapos tumitigil huminga. So that's sleep apnea. So that worsens the quality of the sleep, so that they're very sleepy during the day, the following day. No? Then you try to create a treatment plan. You try to plan stimulating activities during the day, avoiding long naps, avoiding stimulants. And of course, you try to manage expectations. No? We don't expect elderly people to sleep for 9 to 10 hours per day. No? That's just impossible. And then you try to evaluate every now and then how effective your plan is. And don't forget to address caregiver fatigue, no? Because in the situation of that we have, like GCQ, no? So everybody's in the house. It's like 3 generations in the house, no? So this is the elderly person, their children who are taking care of them, and their grandchildren. But usually there is one person who's primarily responsible for the person with dementia, and we call this the primary caregiver. And these are persons with the biggest responsibility of all. No? It really tests their strength and their patience. No? But we have to reiterate to them that they are human too, and they need sufficient rest, sufficient sleep, and time to take care of their own needs. No? So this is a challenging time for the family because they need to step up, unite, and cooperate, and they need to do their share in caregiving. So we are the Alzheimer's Disease Association of the Philippines, founded in March 2000. No? So it's a long-running organization. We're affiliated with the Philippine Neurological Association and also with the Alzheimer's Disease International. It's a London-based non-governmental organization with official relations with the WHO. ADI actually heads the global initiatives for making the national dementia plans worldwide. No? We are over 100 countries in membership with ADI. But ADAP is an organization of persons with dementia, their families, their family caregivers, and the dedicated healthcare professionals who are caring for dementia. So we are doctors, neurologists, psychiatrists, geriatricians, and we have therapists, we have nurses, and the like, and family members also. So because of the pandemic, we needed to step up. So we improved our website, but our most engaging platform remains to be Facebook. No? So yes, if you need some resources, aside from WHO, we also have a lot of uploaded materials in the Facebook page of the Alzheimer's Disease Association of the Philippines. Before, we used to say that these are the warning signs and these are mostly our infographics before for early detection. But with the pandemic, we needed to step up. No? In the early part, end of March, we were able to upload modules on how to avoid COVID. But as the months dragged on, we had to level up, and then we had to change. We had to change the module into caring for persons with dementia during the time of COVID. And then we got a lot of persons with dementia getting COVID. So we had to do that as well. No? So it evolved over time. And because prevention is better than cure, we incorporated several preventive measures in the Facebook page also. No? So these are actually taken from infographics from our Facebook page. No? Because a lot of you will say, they are so bored and so are we. So what are we going to do? So I agree with Jazz. For persons with dementia, a schedule helps a lot. But remember, you should be flexible. No? A rigid schedule is not a good thing. And then you can make a list of people that they can call. Video calls are better than phone calls because they can actually see the person. They can comment on how they're looking today, how they're nice, how nice their clothes are, or how nice their lipstick are. And then you try to regulate the number of relatives so that hindi mauubos in one day. No? And then you try to incorporate persons with dementia in the daily activities in the household, like folding clothes, washing vegetables, and then watering the plants. And even when they're watching TV, don't just let the TV become a babysitter for persons with dementia. You can ask them things like, oh, do you know that celebrity? Do you like the dress? Does she sing well? So you ask them for comments. No? And this is also a time that you can pull out all the videos, old videos and photo albums, and then you can discuss important timelines and occasions, family occasions. And then you can ask them for details about this. No? Who is beside you? Who made your dress? What place did this happen? No? Remember that persons with dementia may have very poor short term memory. They may not be able to recall what they ate earlier or what you said 5 minutes ago, but their memory for the time when they were 20 or 30 years old may still remain vivid. So these things you can ask them. And if they're quite prayerful, then you can encourage them to pray because it gives them peace of mind. It also lessens their anxiety. And then having three generations in the house is a very good opportunity for family games. No? So you can ask them to participate in games. You start with things that they already know. But if they don't know the games, try to make it simple first because remember, they have poor memory. So you try easy games like pares-pares or tong it's mahirap na yata and pusoy. No? If they know mahjong, you can encourage them. Just recruit playmates within the house. We don't want playmates outside the house. They can do Scrabble, Word Factory, or even bingo. No? And then you can download very simple games on the cell phone. Then you try it out with them and see if they enjoy it. When worst comes to worst, you can do video, okay? If you don't have the machine at home, you can download apps on the phone that allow you to sing video, okay? I believe 95% of Filipinos can carry a tune, so this should not be a problem. And it's actually quite entertaining. And then when they're really bored, you can go around the world with virtual tours, and these are widely available on YouTube and several other platforms. You can ask the person with dementia what cities they have always wanted to see, or you can start with the cities that they have been to and then go on with that. No? So you can do local destinations first and then international destinations. If they're particularly concerned with art, there are a lot of virtual museum tours that you can access for free online. And don't forget physical activity. No? You have to find safe exercise activities for them. If they are still strong and healthy, they can do Zumba via YouTube. Okay, so they can do Zumba. Or if they are frail, if they're prone to falls, you can recommend chair exercises for elderly. And again, this is widely available. Just make sure that they have very good music because that will encourage them to perform longer during the exercise. And as always, we have to find creative ways for cognitive stimulation. No? These examples were shared to me by my patients early on in the pandemic when I shifted to telemedicine for the safety of everyone. Those families who used to have Sunday lunch regularly converted it into a Zoom Sunday family lunch and they became international. So everybody can join in the Zoom meeting and the grandchildren perform like before. They sing, they dance, they read poems, and then they are able to check on one another, even if some of the members are abroad. And then during the weekdays, there is a schedule of one child or grandchild calling the person with dementia, saying hi, catching up. And then again, the online exercises. Some elderly persons don't want to take a bath or they deny that they have taken their meals. So sometimes a signature sheet is necessary to document this. They may be assigned simple tasks, right? Taking medications, but make sure that you check also. And then a checklist if the pets were fed already. And after the exercise, you can give them rewards in the form of small snacks. Or if they need non-caloric rewards, you can give them a massage, aromatherapy, manicure, pedicure. But again, within the house, we don't recommend them going out. No? In severe cases wherein they are really, really agitated and yearn to go out, because remember, all services were suspended. No? my patients who used to have painting and music therapy classes, all of a sudden we're just stuck at home. So it's really, really difficult. So what I recommend recently was that they can be taken for joy rides. So they just sit in the car and then they're brought around in their favorite places, but they don't go down. And then some neighborhoods are well dispersed. There are not a lot of people, so they can take walks. But again, wearing face mask and face shield, but it's really something that's very uncomfortable for elderly persons. No, they keep on fixing it, and so lalong nako-contaminate. So it's really, really a challenge. So again, if you need help, you need resources, we are available for you. This is the Alzheimer's Disease Association of the Philippines. We have infographics, tips, and even videos. No, even all our guestings here in WHO or TV and radio, we upload it there so that you can watch it in your own free time. So with that, I end my talk. Back to you, Albert.
Thank you, Dr. Michelle. That was a very comprehensive presentation. So actually, a lot of the questions which were already placed in the Q&A box have been partially answered, but not to worry, dear friends. Yung mga questions niyo po, we are monitoring them, and the panelists are also seeing the questions. So, but before we go to that, I'd like to ask first for a reaction or intervention from Miss Carla Cuadro, our speech pathologist who is with us this morning. Ma'am Carla, over to you.
Hello, good morning, everyone. So, my work as a speech language pathologist has taught me that language communication is life, and that the ability to express one's thoughts and understand others via speech, gestures, the tone of voice, even with one's eyes, are key to one's tenureship in the society they live in. But as a doctoral student of Philippine Studies and Anthropology, I learned that for every cultural group that dominates itself, there will always be those who fall through the cracks of society, marginalized by their own kind. As a clinician, I sit with families talk about their parents, especially those with dementia, about their troubles, their illnesses, their inability to talk, eat, to understand, or to remember. Nowadays, via teletherapy and home visits, I do the same thing. The effects of the lockdown on our very selves is undeniable. It is easier for us to become irritated, run out of patience, be ticked off by the smallest things done by our older members of the family. And for those of us who live with our older parents and relatives, particularly in small quarters, it is a common occurrence to hear of stories about elderly bearing the brunt of other people's anger and frustration. What am I trying to say here? I would like to pick up from what Dr. Vergara said earlier, that ageism tends to worsen discrimination against older people. Remember that language we use, the language that we use, tends to shape our perception of reality. Now let me break down that for you. How we call, label, name, describe, categorize older people actually dictates how we think about them. The Philippine culture, for all its well-known concepts of respecting its elders, saying po at opo, and the world-renowned gesture of mano po, unfortunately, our culture is a deeply ageist culture. Take, for example, the common phrases that I hear so many times from many, many older people. Pagbigyan mo na ako, at ako'y matanda na. Ay, grabe, makalimutin na talaga ako. Alam mo naman, senior moments, pagpasensyan mo na ako't gurang na, nag-uulyanin na ata ako. And it is unfortunate that I hear the following comments from people who surround them. Bilisan mo na kasi, ang bagal-bagal mo. Ano? Ayaw mo ng ulam? Gusto ng mga bata prito eh. Pambihirang matanda na ito. Nag-uulyanin ka na ba? Tatay naman, ang kulit-kulit mo. Sinasabi na nga na hindi tayo pwede lumabas. one gets to gauge the kind of society one belongs in by the way we treat the people at its margins. It's women, it's prisoners, it's disabled populations, it's older people. Aging is not a disease. We need to stop thinking about aging as something undesirable and deplorable. We are all going to reach old age. Do we not desire to establish a Filipino society that places its older members in respectful high regard? And it takes a long time, super long time to change people's outlooks. It takes a linguistic revolution to change cultural constructs. And how do we change? How do we change, cultural constructs? How do we change the thought that aging is not equivalent to pagiging ulyanin, nor is aging equivalent to dementia? Hindi po lahat na matatanda ay magkakademensya. Inuulit ko po, hindi po lahat na may edad ay nagkakademensya. What if I tell you that doing a language revolution is very simple? That if you could change something in your words, in your tone of voice, in how you present yourself to older people, or how you, older person, present yourself to the world, you can actually alter how Filipinos treat its elderly and even how it treats its people with dementia. What if older people speak to you like this? Dahil sa inantay mo ako magsalita, mas naiintindihan kita. Salamat ha. Thank you for walking with me. I really like spending time with you. I like how you cook. It's soft enough for my teeth. Tiyak, mabubusog ako nito. And what if you, member of a family with an older person, what if you start speaking to older people and people with dementia like this? Babaan ko lang po yung volume ng TV. Sigurado makakatulong sa inyo ito. Or, sige lang po, antayin kita. Huwag kayong mag-alala. Hindi po senior moments. Only opportunities to show you I am listening. My good friends who are listening in, the slowness associated with aging is a social construct. If we weren't in such a rush, they wouldn't look nor feel slow. Many behavioral issues that our older loved ones manifest may not be because of them, but because of us. When we depersonalize an older person, whether or not the person has dementia, we exclude them from our society. Any person, ikaw man po o ako, who has been marginalized, na isatabi because of our words, our tone of voice, our thinking, our poor pakikitungo, will always resist. When an older person resists, they are in truth fighting for their right to be heard and to be valued. Older people are not old. They are not matanda. They are not mabagal. They are not ulyanin, tampuhin, makulit, pihikan. They are not mapagpuna nor reklamador. Older people are just who they are. Honor and value their need to keep their own person and their sense of well-being. If you po are the older person's safe haven, but you treat the older person otherwise, wag po natin sisihin ang pandemic dahil kayo po ang kanyang kasama. Remember, the language that we use shapes how we think of our older Filipinos. Oras na po para baguhin natin ang ating pakikipagkapwa sa ating mga nakakatandang Pilipino. Maraming salamat po.
Maraming salamat, Ma'am Carla. Alam niyo po, hirap na hirap ako as a moderator to interrupt such a good speech. I mean, I'm not saying this to just patronize Ma'am Carla, but That was so heartfelt. In fact, I was having a private chat with Dr. Shelley, who was with us in day 1. Day 3 nga nag-private chat kami. Sabi ko kay Dr. Shelley, I can feel it so much because I'm also a caregiver for my own parents, apart from being a public health practitioner. And I just like to repeat what Carla said, no? The language that we use tends to shape our perception of reality. I think it also binds together all the presentations that we have heard thus far. But there's one more intervention that we'd like to hear from. So thank you so much, Carla. I would now turn over to our colleague from the WHO Regional Office for the Western Pacific, Dr. Martin Van den Dyke, to give his reaction or comments on the discussion thus far. Over to you, Martin.
Thank you, Albert, and good morning, everyone. Wow, 486 participants. That's a big audience, and I'm very pleased for joining you today. Albert, I just prepared four comments for to share with you, please, based on the intervention of our speaker, and thank you very much for those. The first thing I would like to highlight is, yes, some older adults have experienced improved anxiety, stress, and loneliness in response to the measure for the pandemic, and they may be the last population for whom the lockdown will be lifted. So this is still ongoing, and as you mentioned strongly, stay socially connected. That's the best support we can provide them. It's not about only social distancing, it's rather physical distancing and how we stay connected together. And Yasmin and yourself already addressed this previously. So that was the first point, and it's very important. The second point, I think it's about a family or a caregiver and the caregiver fatigue that was mentioned by Dr. Anne Lacan. We also need to take that in consideration, and family members should be encouraged to take care of themselves and to seek help as needed. And caregivers of older people or people with living with dementia should also be offered support, and alternative to home care should be provided, and we see excellent community initiative in the Philippines and in the region towards this objective. The third point I would like to stress is, of course, related to people living with dementia in the Philippines, but also in the region and globally. Thank you, Dr. Anne Lacan, for your presentation, and we are pleased to see the initiative and in the Philippines for people with dementia and how you adapted current services using telemedicine and also many other initiatives. But please allow me to say and to share with you that despite the progress we see in the Philippines, in the region and globally, dementia remains a major challenge, and we could do better. We could do more together. And the response has also been hampered by the lack of services for people with dementia, not only in the Philippines, but overall in the region, globally, including high-income countries. That's why at WHO, we try to work closely with DOH and partners such as ADA, Alzheimer's Disease International, to move the agenda. And I think this webinar is also a good opportunity to advocate, and I hope that in the coming weeks, we can have a strengthened collaboration to do more about this. And lastly, and as you rightly pointed out, Albert, and as Carla mentioned, just would like to finish by a positive note. The older population is incredibly diverse, and most older adults are coping well, and they are helping us. I've been in the Philippines for 3 years now, and I've learned a lot about your community and how you deal with the older, and I'm very pleased to see that. I also have an older man, Mama, I also have a older neighbor, and they're helping me a lot. Yes, I'm socially connected with them. I call them because we need to, that's what we need to do, isn't it? But they're also helping me a lot, and they help the community. They help all of us because of their wisdom and their experience. They've been through a lot of things, and we constantly learn from their experience. And this webinar is also a good opportunity to make their contribution visible and something I think that will also give them a sense of dignity and responsibility to showcase how much support they have provided to the whole community despite the lockdown circumstances. So that's what I wanted to share with you, and thanks again for the invitation, and I look forward to continue the collaboration with most of the speakers here. And yes, thanks, Albert.
Thank you so much, Martin. So the time is 12:09, but definitely we are not yet done. There are quite a few questions. Thank you so much for everyone for typing their questions into the Q&A box. Alam niyo po, kahit hindi namin na tatanong, even if we cannot ask all of the questions because of limited time, whenever you type your question to the Q&A box, it goes into a database which we look at later on, and it helps guide us, the WHO and also the Department of Health, when we formulate our positions, our policies. So this is true connection to the community. And with that, I ask all the speakers and the panelists to please show your video so that we can go straight to the open forum. All right. So the first question now is for Dr. Jazz. Yan, Dr. Jazz. Ito yung mga pang Miss Universe question. Pero how can I be an effective carer for seniors' mental health when I am a mental health struggler myself? Dr. Jazz.
Okay. Thank you, Albert, and thank you for that question for whoever has shared that. So the same way that we take care of our health, the same way as we take our physical health, pareho rin yun, ano? Kailangan natin ng pahinga, sapat na tulog, masustansyang pagkain, yung tamang pagkain ang kailangan natin, at mga physical activities. Now, if you have a mental health condition, if that is what you meant, the struggler, if you have a mental health condition and if you are being treated for one, please make sure that you continue to have the prescribed medications that you have. Now, you can talk with your mental health specialist or your care provider about how to continue that support during this outbreak. Importante, as we have emphasized here again and again, is to keep in touch with people who would care for you and you can actually get in contact with to provide you support when your mental health declines. So marami tayong mga experience in the past that have helped you survive some certain adversities and stresses in life, at balikan natin to, ano yung makakatulong sa atin sa ngayon, sa sitwasyon na to, in a safe environment. Thank you.
Thank you, Dr. Jazz. All right, so this next question naman po is for Dr. Michelle Anlacan. Yan. Kasi nabanggit ni Dr. Michelle kanina, and also Dr. Jazz, a lot of mention about technology. However, the question goes, how do we address the needs of the community dwellers who are older? So older community dwellers who have dementia if they do not have the means like gadgets to access those apps. Dr. Michelle.
This is the time to be really, really creative. No? So the family can have regular storytelling time. They can share their experiences. Some families have movie time. So like they look out for certain TV shows at night. No? So that's their movie time. They can share recipes. They can also have reminiscence therapy, going through the photo albums. And then you can always go back to the old games. No? And this will benefit the grandchildren also, no? So now is their time to learn the games of the olden days, like dama, sungka. I don't know if people of our generation still know that, but I did learn that from my grandfather. So our children can learn that too. So it's a two-way street, no? Hindi lang naman sila yung natututo sa atin, pero tayo din, no? And it's really a fun time. But even simple phone, simple gadget is very, very helpful, because I always tell persons with dementia and their families to take pictures. No? Whatever they're doing, try to document it, take pictures, because they can always go back to this later on. No? Because you're creating memories as we go along. And this is a one-time pandemic. Hopefully, it will never happen again. But it would be nice to look back on this later on, how we were able to cope and move on.
Thank you, Dr. Michelle. Now, that's a very nice term I picked up over there. Yung sinabi mo na reminiscent therapy. Parang that strikes me as the formal term kasi napansin ko I mean, with my late grandparents and even now with my parents who are seniors themselves, when we start talking about memories, parang nare-relieve sila and then the story goes on. And sometimes kahit minsan paulit-ulit yung kwento, okay lang kasi when you see them smile and when you see them para bang relieved of the mental stress of this pandemic, it really helps. Thank you, Dr. Michelle. Now, this next question that we picked up from the Q&A box, this is for Ma'am Carla. So, Ma'am Carla, eto. My father-in-law is already 81 years old, and frequently he tends to always tell us repeatedly and insist that the time is different and that the date is different. And usually, he says that ina-advance nyo palagi ang date at oras. So you keep on advancing the date and time. And he does not want to believe in us, but in other people, he believes. So it's about a discrepancy in the perception of the time of the father-in-law. But he doesn't trust the caregivers, but he trusts other people. Please enlighten us on what's happening and how we can assist him, how we can reach out to him. Ma'am Carla.
Well, one way of looking at things is that if the father tends to believe other people, have other people tell him what is going on. It is not for us to insist for the person with dementia our reality. If their reality is that they trust another person, then have that other person talk to them. The situation might be moot and it will result in a lot of frustration in between parties if we keep on insisting na ito dapat ang paniwalaan nila. Doon na lang po sa pinapaniwalaan nila sila at sila na lang po yung maaaring kumausap sa kanila.
Right. Thank you, Ma'am Carla. No, I like to echo what you said. No, it is not for us to impose our version of reality on them. Kasi that is part of the process, no? I mean, not the process, but the condition na nag-iiba nga yung perception. So that's a very well taken advice. So we work around the situation. We become more understanding. And again, as Carla mentioned earlier, kailangan ko talagang tingin yung kodigo ko kasi maganda yung wording eh. The language that we use tends to shape our perception of reality. So we need to be careful and we need to be mindful of what we say when we talk to our wards, so to speak, mga inaalagaan natin. All right, this next question is for Martin. The time is 12:16. Maybe ganito na lang. I will say the question out already, Martin, and please consider what you would want to say as your closing remarks later. But because I think I sense that our guests still want to probably ask one or two questions. I'll ask those. And then this is the closing question for you, Martin, later. What is the appropriate label for our dear seniors? Do we call them senior, elderly, aged, or geriatric? Or are there better descriptions for them in the new normal? So for all of those who are listening to us, and you are in the Zoom room or in the YouTube channel, I already activated the chat box. Type in your suggestion, senior, elder, aged, or geriatric, or other words that you think should be used to refer to seniors. Martin will be able to see that and then he will give us his answer later. But before we go to Martin, I will now ask other questions. Ayan. So I'm looking here. I saw a very good question. Ito. Maybe I'll ask this for Dr. Michelle. Yeah, Dr. Michelle, the question goes like this. My paternal grandma had Alzheimer's during her latter years, and my mom, who is now age 90, has dementia. I'd like to know if Alzheimer's disease is an inherited trait, as I'm already a senior myself. This is actually a senior citizen who is caring for a 90-year-old mother. So, Dr. Michelle, your thoughts?
Yes, if you want to check for your genetic predisposition, you can do so. We call this the ApoE4 allele, but it's just a susceptibility gene. Even if you have it, it's not 100% sure that you will have it. What we know now is that 10 to 20 years before your memory declines, that's when the abnormal protein accumulates in your brain. And that also gives you all the time to do preventive measures. And again, we have data on this. How to prevent dementia? Actually, there's no shortcut. There's no magic pill to prevent dementia. what you need to do is to control your vascular risk factors, control your hypertension, control diabetes, control your weight. If you have depression, have it treated. Midlife, if your hearing is declining, you need a hearing aid. You need to you really need to check that, because those things are correctable. Social isolation is a very big factor also. So if you are not able to go out and mingle with other people because of the pandemic, then you need to be socially connected still, no? By online platforms. Stop smoking and do not drink alcohol. So these are evidence-based preventive measures. So there is still time for you, and you need to exercise. What we always say is when you exercise, your blood circulates and all the abnormal proteins in your brain are washed out. No? So for you to wash that out, you need sufficient exercise, about 20 minutes, 5 times a week, and you need adequate sleep, because when you sleep, your brain cleans itself. So you really need adequate sleep. I hope I answered that question.
Thank you, Dr. Michelle. Well answered. I mean, you did mention that there's actually a test for the gene that causes susceptibility. So para po sa ating mga kababayan, hindi po yun ang magsasabi kung magkakaroon kayo. Sinasabi lang nung test na yun kung maaari kayong magkaroon, kasi iba sa atin, mas mataas ang tsansa na magkaroon. Pero hindi yun yung be all and end all. And maganda yung sinabi ni Dr. Michelle, the preventive measures. It's not about finding out and stressing whether you will get dementia or not, but it's about preventing it. Exercise, proper sleep. Now, this last question before I go to Martin. So, keep your suggestions coming in the chat box. Ano ba ang dapat itawag sa mga matatanda? How should we call older people in the Philippines? Lolo, Lola, I'm seeing a lot of suggestions. Seniors, elders, older person is nice to hear. So we're going to hear from Martin in a bit. But before Martin, I'd like to ask Jazz. So Ambrose Alvaro, who in the Q&A box mentioned he's actually a foreigner, but he asked a very good question. He even translated it in Filipino, probably using Google Translate, but doesn't matter. You're welcome to ask the question. I would like to ask, which should be taken as a priority? Physical problems, mental problems, or both? Dr. Jazz, what are your thoughts on this? Physical conditions, mental conditions, or both? Which is the priority when it comes to evaluating or taking care of yourself? Dr. Jazz.
The way probably to answer that better is there's no health without mental health. Mental health is really part of the overall of our physical health. It be social, well-being, or physical. So it goes hand in hand. Hindi mahirap magpili kasi when you take care of your physical health, it also can benefit your mental health. And when you look after your mental health, kasabay doon yung physical health, mapapalagaan mo yung iyong kapabilidad sa kabuuang health. So I will have to leave it at that. Thank you.
Thank you, Dr. Jazz. Again, there is no health without mental health. It's not about one being more important than the other. It's about looking at everything together. And with that, I will now pass on to Martin for the closing remarks and also to answer the question, what is the best way to call our older people, our elders, our seniors? What's the correct term? Or maybe there's no correct term. Martin, over to you. What do you think?
Thanks, Albert. Good question. At WHO, we would say as appropriate to the national context and as appropriate to the culture. So I think you guys know better, but we may say older adult or older population. But that's the good question to ask. And we need to continue to advocate for mental health and for older people. And this webinar was the good opportunity. And that's what I would like to say as my closing remark. Every emergency and this pandemic is an opportunity to do better and together to do more for both mental health and for aging. And at WHO, we take that very seriously because last week or 2 weeks ago at our regional committee meeting, there was a discussion on aging, and we would like to proceed with this agenda. This kind of webinar or the overall way that mental health has been highlighted during the pandemic brings a new understanding with a highlight on stress, on common mental disorder, and new hope to have more services available in the community. And so that's what I wanted to share with you to close this webinar. Thank you, Albert.
Thank you so much, Martin. Well said, well said. And this is definitely one of many ways by which we are reaching out. We'd like to thank all. There are still 454 participants in the Zoom room alone and 177 on YouTube, even though it's already 12:24. So before we take lunch, again, the most asked question of all, and I'm going to share the answer. Where can we get the slides? Okay, so that is like the favorite question of everyone, and we will send out an email. If not later within the day, over the weekend, but definitely after this webinar. Before we give you the link to the folder, which contains all the materials and the links, what you're seeing right now is a QR code which will lead you to the feedback form for day 3. So let us know what you think of our session today, day 3. There is a link at the top, but if you're using your phone, you can just point the camera and the phone should scan the QR code and lead you to the website, which will give you the chance to let us know how you think of day 3. For the days 2 and 1, I will include the links inside the folder, the link I'm now showing. So if you can't remember the QR code, because no one will remember a QR code, the link is bit.ly/healthy seniors folder. But again, you can use your phone, you can aim it to the screen that I'm showing right now, and the QR code will lead you to an online shared folder which will allow you to download all materials, the slides from days 1, 2, and 3, and also some additional materials that Dr. Hiro, remember from first 2 days, he did put guidelines. We're going to put it inside the folder. And also all of the links that Dr. Jazz mentioned, all of the resources mentioned by Dr. Michelle, if she wants to share anything, we will put it inside there from the Alzheimer's Disease Association of the Philippines. And with that, thank you so much. I will now stop sharing, and I ask all the panelists to please show your video for a last goodbye to our participants before we sign off today and close the webinar series. All right. I see that even, Dean Aguila is also online. If you're comfortable showing your video. Ava, of course, Dr. Ante Trinidad, Ma'am Carla, Dr. Shelley, those of you who are still logged in as panelists, so we'll just be waving and saying goodbye. Thank you so much there. I'm seeing Ava, our organizers, lead organizer. Thank you so much. And yeah, and si Ma'am Carla, please drive safely. I'm sure you're using hands-free. Dean Aguila from day 1. Si Dr. Shelley, baka hindi naka-on ng camera. That's okay. But thank you so much, everyone. Have a great lunch. Good morning, good afternoon, and good evening, wherever you are in the world. Stay safe. Paalam po. Goodbye.
Bye-bye.